Hi, everybody. It's Angela Gill at the MHP Foundation. We've been doing a series of emails and Facebook posts for our end of the year giving campaign. We have 6 projects that our staff, different departments, have designed, um, and we've decided to invite the public to help us fund those projects here at the end of the year. Our staff has also given their own money. They are on, I believe it's their 6th year of giving over $100,000 a year, so we could not be more proud of them for doing that. And we just decided, let's bring the general public into and give them an opportunity also to participate and to see some additional things that go on behind the scenes at the hospital that the average person may not know about. Today I am with Suzanne Carlton. She is a disease management nurse practitioner, and so she works in disease management here at MHP. She's going to talk to us about heart failure, and one of the projects that we're funding this year is to give a scale, like a bathroom scale that you step on and weigh yourself, to heart failure patients who can't afford one. And she'll tell us why that's important. But first, Suzanne, why don't you tell us a little bit about your job and what you do each day?
Well, each day I see a variety of patients in our disease management clinics, and some of those patients include patients that are in our heart failure clinic program. And those patients we get from referral, whether after an inpatient stay or from their cardiologist and from their family physicians, that they need just an extra little bit of help and resource for us to do some education and make sure that they are plugged into all the resources that we offer here at the hospital.
That's great. But how many people do you see in a day?
Um, Anywhere from about 10 to 15 patients a day.
And you get to spend some time with each one. It's
Yes, we
yeah.
do. We
Okay.
do, which
And
is really nice. We are able to kind of spend that little bit of extra time in education and help those primary care providers with a little extra support, as well as the cardiologist. Like I said, we're just an extra resource for these patients, going over anything from making sure they understand what the disease process is with heart failure and how that works, to understanding their diagnostic tests, and understanding their medications and why they're taking them. And one of the most important things we do in the heart failure clinic is making sure patients understand how to self-monitor their symptoms and how they're feeling. And one of those things that we offer are making sure they understand the importance of daily weights and weighing themselves.
why is that important? What is that if someone's weight drops up or down? What does that indicate um, for when a person has heart failure? How does that work?
Well, one of the things that we really stress to patients, of course, is this self-monitoring their symptoms. And we often refer to our stoplight tool that indicates a green, yellow, and red indicators as far as how they're feeling every day. And we really stress the importance of these weights because oftentimes, while they may feel fine or may almost get used to feeling a certain way, sometimes that 3 pound weight gain or a gradual weight gain over a few days can be an early indicator that we need to be watching them a little bit closer, and maybe they need to be getting in to see their cardiologist or their family physician, or even really adjusting medications to help keep them out of the hospital. Because that's really our primary goal, is to keep them out of the hospital and avoid those hospitalizations for acute exacerbations with their heart failure.
And try to keep them on an even keel. And
Absolutely,
is
absolutely.
is it water weight?
It can be, absolutely. Um, it's important to know what the whole picture is. That's why we like to spend quite a bit of time with these patients when we first get them into the clinic. The program is fairly intense for about a month to 3 months time. So we can really get to know these patients and see what else is coming into play with their health. So many times patients have serious comorbidities, including kidney disease, which can alter things as well too. Like I said, it's really important that we know the full picture on these patients and really how we can work together to make sure we keep them out of the hospital and keep them stable with this.
That's great. That's great. And well, it really improves their quality of life, and if
Absolutely,
they
yes.
know how to take care of themselves, they're aware of those warning signs, and something as simple as how do I feel today, and how's my weight, um, they can. It's a good way to manage. I think it gives you a feeling of more control over your own
Yes, it
self.
is. It does. So often patients get a little overwhelmed by having a lot of appointments and things like that. So we want to make sure that we give them the tools that they feel like they're in control and are really kind of taking over, guiding their health care and how they're feeling.
That's great. Yeah, I didn't know too much about these clinics until um, these projects came up, and I've had an opportunity to talk to you, and I spoke with Sophia Keith in the diabetes management, and it's really interesting. I mean, I'm really proud of what we do here. I think it's a great service, and we're really helping people, and I am very impressed with our staff, and I've enjoyed talking with you. I've learned so much, and I hope that this conversation will help people see some of the extra things that are going on at MHP. Maybe provide you a little education of your own, and perhaps inspire people to help our staff support these projects that are really important for patients at MHP. So I want to thank you to Suzanne for your time this morning, and
Yes, thank you.
I think so. All right. Thanks so much, and enjoy your holiday coming up and
You
all of those.
too. Thank you.
Thank
I
you.
appreciate it.
Sure. Thank